Dr. Kirk Eriksen is a chiropractor, and his particular type of chiropractic care has been featured on the Montel Williams Show, and it's also been featured on Good Morning America. And with this particular type of, I guess, interviews and national publications and previews of things, people are beginning to see the value of the particular type of chiropractic care that you offer. This has to do with blood pressure. This is amazing. How can one simple procedure affect blood pressure?
Well, what was featured on Good Morning America was the results of a study that was published last year in the Journal of Human Hypertension. And my connection to the study is that the doctor who took care of the patients is a colleague of mine who uses the same type of chiropractic procedure that I do. Now, basically what happened was a group of patients were given a fake adjustment. And you might say, well, how do you do that? Well, the adjustment that we give to the upper neck is very little is felt.
But it's mathematically and geometrically designed to do the job.
So there's a way of deceiving patients, so to speak, in this case. Now, another group of patients got the real adjustment. All the patients had high blood pressure. None of them were taking blood pressure medication for the course of this study, and none of them were in pain either. Now, they were checked at Rush Presbyterian Hospital before and after the adjustment, and then 2 months later. And when the statisticians brought the results back, the lead author didn't believe the results because they seemed too good to be true. But when they double-checked all the results, they found out that the patients that got the real adjustment, their blood pressure, their systolic blood pressure, the top number, dropped an average of 17 points. Whereas the diastolic, the bottom number, dropped 10 points. Now keep in mind, this is the equivalent of being on 2 different blood pressure medications. This is amazing. And this was a randomized, controlled, double-blind study. The lead author is Dr. George Bacris. Dr. George Bacris is one of the experts that put together the clinical guidelines for medical doctors in the treatment of hypertension. So he's one of the leading experts in the world on this topic. So it was an amazing study. However, I do want to say that it is not implying that chiropractic care is a treatment for high blood pressure and that we're implying that patients should get rid of their medications. That would be, improper.
But treating the alignment of the spine in particular can alleviate pressure and stress.
Absolutely, and on the Good Morning America segment, Dr. Timothy Johnson, their medical expert, explained how this is a plausible hypothesis, because what we're working on an area here that is right below the brainstem, and the brainstem has all these control centers for the vital regulatory functions in the body, including blood pressure. So stress and tension at the base of the skull can obviously affect blood pressure, and it's something that we do notice clinically. There's been other studies that have shown this as well. However, this is the first study designed of this magnitude that showed these results.
And I understand that a medical doctor checks patients in his office and sends them to Chicago for treatment.
Well, that's what started this study. There was a medical doctor that over the past 20 years has referred about 6,000 patients to this one particular chiropractor because of the amazing results he kept seeing with his patients. He has learned how to check patients' alignment to determine if they have an atlas misalignment, and he sends them to Dr. Marshall Dickholz. Now, this doctor had influence with Rush Presbyterian Hospital in Chicago and University of Chicago that led to these experts that decided to study this particular work. So this is the beginning of it.
It is amazing, and the thing about it is that you don't have the side effects that some drugs cause. It's not going to be a cure-all for everybody.
Absolutely.
If you would like to know more about the treatment that he does, you may call him at 334-793-7992. Very interesting without pain, the adjustment, I might add. Dr. Kirk Eriksen.